Hello and welcome back to the channel. I hope that you are doing well and you are in a peaceful place in every area of your life. If you're new to the channel, welcome. And if you're coming back for more good information, thank you. Nice to see you again, friend. Thanks so much for your engagement with this channel. Thanks so much for watching the video in full, commenting, sharing, subscribing to the channel. I really do appreciate you so very much. I want to always tell you about my disclaimer at the top of the video. I am not a medical doctor, but I am your uterine health advocate. I'm here for you to spread information and awareness about all things uterine health, right? So the name of the channel is Uterine Health. Let's talk about it. So let's go ahead and get in and talk about it, right? I know I'm really pushing it out here. I did another video, but I says, well, I'm still out here. Let me see if I can do some quick research and, crank out another video, right? So here we are. So today I want to finalize the conversation regarding uterine transplant. I talked about it in a previous video, and I want to discuss today, just really briefly, the requirements for the recipient and for the donor that is donating their uterus. Anytime there's an organ donation, there's all these things that people have to go through. It's not as simple as, here, take my heart, and that's simple. It is a very complex surgery, and it is something not to be taken lightly. And it is something that you should work with your doctor and your family before making any sudden decisions, because they will know best. Because I always say what works well for one woman may not work well for the next woman. So let's go ahead and get into this video. Hopefully I'll finish before, because I hear the thundering coming, So again, I just want to go over some key factors. The key factors for having, a uterus donation, a uterus transplant, the purpose of it. So the goal is to treat absolute uterine infertility for women born without a uterus or had it removed. So this procedure, this uterus donation, transplant donation, is for people to treat women that have absolute uterine infertility, women born without a uterus or had it removed. And then again, it's temporary in nature. The transplant organ is temporary. This is not an organ transplant that you need to survive, like someone may need a kidney or your lung or heart or something like this. This is like I like to think of it as an operation procedure to help bring life as well, though. So doctors remove it. Doctors remove it via hysterectomy procedure after 1 or 2 successful pregnancies, so that the patient can stop taking the anti-rejection drugs. So if you're going to be taking, deciding to have a uterus transplant, inside of yourself, you do have to take anti-rejection drugs to make sure that your body doesn't reject the new organ. And you do hear about that with other organs. People do say, my body's rejecting this kidney, I need a new one. So that's fairly common, but thanks to modern medicine, we're able to I feel some drops. Thanks to modern medicine, we're able to maybe I should move inside. Okay, thanks to modern medicine, they're able to, have different methods and drugs to help your body receive the new organ. And again, the source, you can receive a uterus from a living donor, like a family member or a close friend, or you can even receive it from a deceased person that is a donor. And what I was excited about is that major medical facilities run specialized programs and clinical trials all throughout the United States, as this procedure is only 10 years old in the United States. So this is very encouraging. It's very encouraging that they're running specialized, strategic, targeted, clinical trials and programs about uterus donation to be able to help women that have the absolute uterine infertility, born without a uterus, didn't have a choice if they wanted to have kids or not. So the fact that they are invested in this is very encouraging for me, and I hope it's encouraging for all women, to be honest. So here's the process. If you are a woman wanting to qualify to see if you're born without a uterus and want to see if you can actually qualify for this particular organ transplant. So to qualify for uterus transplant, a person, oh, there's a hummingbird, a person must have absolute uterine factor infertility. There's no working uterus and you're born without one, is what that means. And you have to be between the ages of 20 and 40 years old. You have to have healthy ovaries. You have to pass a psychological test. general health clearances, and have frozen embryos ready for IVF. Intro fertilization is what that's called. So as you can see, there's a couple of things you need to have. You have to be a person. They just don't do this haphazardly to just this transplant for anyone. You have to have a non-working uterus or born without one. You have to be between the ages of 20 and 40 years old. You have to have healthy ovaries. You have to have pass a psychological exam. You got to have general health clearances, and you have to have had before the transplant frozen embryos ready to be in place, imparted into the new uterus, which is in form of IVF, intro fertilization. So here are some of the medical and physical requirements. So the infertility diagnosis must be established and must have an absent or non-functioning uterus due to a condition, like I talked about in other previous videos, called Mayer-Rokitansky-Kuster-Hauser syndrome, which is, essentially when you're born without a uterus, or you may have had it your uterus surgically removed prior. So there's an age limit. You got to be between 20 and 40, like I said. Some clinical guidelines will allow you to go up to 45 to ensure, but they do this to ensure reproductive capability. So there's a reason why there's an age limit. You have to have your healthy weight. You must have a body mass index within a safe, healthy range, which is usually under 30. And depending on the center, they might let you get away with being under 35. But again, because all of us are different and the BMI is not exactly, it's an estimated. So that's probably why they let you go up to 35. And you can have no major diseases. You got to be free from severe kidney diseases, diabetes, active infections like HIV or hepatitis, and if you had recent cancer, you have to be cancer free for at least 5 years, and you cannot be a smoker. So those are the things that they look for from you if you're looking to be a recipient. And I understand that, because if they get a viable organ, that's with anything. They want to make sure that they're placing it inside someone that is healthy, that they think that has a chance of, your body receiving the organ so that you all can reach your goal, which is having a baby, right? Carrying a baby to term. So there's fertility and treatment steps you also have to partake in if you are the recipient. You must complete an IVF beforehand to create and freeze your embryos, because a transplanted uterus cannot naturally connect to the fallopian tubes for natural conception. So you've already gone through the IVF process before you even have the transplant. You must be physically able and willing to take a strong anti-rejection drug to eliminate the for the entire time, the uterus is in the body. So you must be physically able and willing to take the strong anti-rejection drug for the entire time the uterus is in your body. So the moment you have the transplant and you have the embryo, you are taking those drugs, and you have to have you must pass a very detailed psychological, social work, and general surgical risk evaluations. So they go over everything with you. They make sure that you are mentally able to handle what's going to happen to you in your body. And they do the social work, and they just do the general things to tell you all the risk and things of that nature. So that's the requirements if you are going to be the recipient. Here are the requirements if you're going to be a donor. So to donate your uterus as a living donor, you must be healthy, a premenopausal woman between the ages of 30 and 50 who has already completed childbearing and has given birth to at least one full-term baby. Okay? So because uterus transplantation is a complex, ever-evolving procedure, specific requirements vary slightly across different hospital programs, right? So however, standard medical and psychological benchmarks are governed by all doctors. So there's what they're basically saying is there are just some things that all doctors do in medical programs, but then there are other things that they can maybe say, oh well, you're 40. You can still be 45. You can still be part of this program. Oh, your BMI is this. So that's what they're saying about that. So here are the core eligible requirements if you're interested in being a donor for someone, a living donor. So you have to be between the age, like I said, of between 30 and 50 years old. And like they said here, those certain research institutions accept people up to 65. So I'm sure that's probably somebody that's healthy and they've gone through the test and they feel that this is a good person to donate their uterus. You have to have a history of pregnancy. You must have experienced at least one successful full-term pregnancy and live birth. I guess they want to make sure that the uterus is able to carry a baby and maybe that you haven't any miscarriages. I'm not sure what the reason behind that is, but that's one of the core eligibility requirements. And the next one is you must have completely finished building your own family and have no desire for future pregnancies. And that's important because if you think about it, they're removing your uterus. And so without your uterus, you won't be able to carry your own baby. So you have to be fully secure that that you're in a good space, that you're like, yes, we're done. We're not having any more kids. And that's it, which is why I probably think the age is between 30 and 50. I'm sure the donation age is probably on the higher age side than anything else. This is just me guessing though. And then uterine health. You have no history of major uterine surgery or severe reproductive health conditions. And as you know on this channel, I talk about so many different things that affect our uterine health. So they make sure that your uterus is healthy, which makes sense. If you're going to get a kidney transplant, you're going to get a liver, lung, or heart transplant, they have to make sure that those organs are viable and they're healthy to be actually transplanted inside of another human being. So that makes total sense, right? So your general health and wellness, if you are a living donor, your body mass index, your BMI must be under 30. Infectious disease, you must test negative for HIV, hepatitis B, and hepatitis C. You cannot have any chronic conditions. You have to have no history of high blood pressure, which is hypertension, diabetes, or any kidney disease. Your cancer status, you must be cancer free for at least 5 consecutive years if to be eligible to be a donor, and you cannot be a smoker. So I understand all of these things that they have in place. They want to make sure that they are working with two healthy people. They're taking a healthy uterus and giving it to someone else to have a healthy experience, right? So I think that. So there is a screening and evaluation process as well. You meet the structural If you meet the structural physical criteria, you must also pass through the medical evaluation before you can be cleared to donate, which makes sense. You want to make sure a person is understand everything that they're getting into. So there is a vetting process for this as well. There is comprehensive blood work done on you. They check for your overall organ function, tissue type matching, and viral markers. There's advanced imaging, so they do pelvic MRIs, ultrasounds, and CT scans to evaluate your uterus structure and ensure the blood vessels are robust enough for the transplantation. Ooh, it's getting windy out here. Okay. And you also have a psychological. You see, like I'm getting darker. You also have like a psychological assessment as well. And this is a mandatory evaluation by social workers or psychologists to ensure you have clear motivations and a strong post-surgery emotional support network, which I think is very good. They want to make sure that you have somebody to be there for you as well, although you have agreed to donate your uterus for them. And the recipient connection. Donors can be directed donating to a specific loved one, which is ideal but not required, or you can donate anonymously to someone on the waiting list. So you can be connected to the person, or you may not. You just may want to donate your uterus, which people do with their other organs. So they want to talk about logistics and financial cost. Facts. I'm looking at the trees if I'm not looking at you. Part of me tells me that I should just stop and go inside. I don't need to be a hero. Isn't that what I always say? I'm going to stop. 1 second. I'll be back. Okay, I'm inside. It got super dark out there. I had to turn on lights here. Hopefully you can see me very well. My Lord, it's just a little bit. Okay, so we were talking about, with you being a donor, a uterus donor for a transplant, we were talking about the logistics and the financial facts. So is zero financial cost, right? You will not be paid for your organ, so that you know that. As commercial compensation is illegal. All of your medical evaluations, surgeries, and routine hospital care will be funded by the recipient or their insurance. So that's good to know. So if you are wanting to donate your organ, you are not going to be compensated because that's illegal, and you won't be paid for that. But all of your care and costs should come from the recipient or from their insurance. So personal insurance, you are required to maintain your own active primary health insurance to protect you in case you experience non-donation related medical issues down the road. So it is also important that you have your own insurance as well, just in case you experience something down the road, because I'm sure there's side effects to everything. Deceased donation. If you do not qualify as a living donor, you can also select standard donation organ donor on your driver's license. Many successful uterine transplantations have utilized organ donation from deceased donors. So they have used uterus from deceased donors. So I have, per usual, two references here. I have one from the Cleveland Clinic, which is from October 22nd, the first 5 years of uterus transplantation in the US. Sorry for that. So I thought that was a very good article because it kind of to me, it lets me know that they're invested, right? The medical community is invested in this. And so now they're looking at the first 5 years of it and, how it's been and the pros and the cons and what they can probably do better, which is great because that means, like, I feel in another 10 years, this is going to be just as advanced as a kidney transplant or the other transplant. Still a complex surgery because it is organ donation, but it's good to know that they're investing. And I love to see that they're investing in uterine health for women. I love that. The second article is from Penn Medicine. It's from May 2025. A mother's meetup like no other for families formed through uterus transplant. I thought this was a very good article just to add here because mothers that have gone through this, they share a unique bond because no one else has gone through this. No one else probably was born without a uterus. And so the beauty in having this opportunity is probably something that they can share. So I thought that was nice that they had a meetup and the article is there for you to read and enjoy like I did. So again, I always try to provide you with information that, is new. Maybe you didn't hear about it, about our uterine health, and it makes you smile. Like this makes me smile to know that there are options for women born without a uterus. And if this procedure is right for them, they can have an organ donation. So I hope this information was important, but as always, if you're not feeling kind, you should always feel kind. If you're not feeling well, you feel some kind of discomfort, please, 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 I highly recommend that you go see your doctor immediately. If there's something that you've learned on this channel, please feel free to share the information, talk about it with anyone else. I am a person that's on a mission to make sure that uterine awareness, all aspects of it, is known about from the hilltops, right? Because again, our uterine health as women should not be shameful, should not be something we talk about secretly, and it should not be something that we're ashamed of, right? We are women. We were born with a womb and things happen. And so we need to be there for each other as a circle of friendship and say, I may not be going through what you're going through, but I have empathy for you and I'm here holding your hand. So, and we have grace not only for other women, but let us learn to have grace for ourselves as well. So until next time, I hope that you have a fantastic day. Talk to you soon.